Good morning, everyone. I will be presenting an abstract presented by Caitlin Atkins. It was a left coronary artery dose exposure that predicts major adverse cardiac events in coronary heart disease negative lung cancer patients. As we know, cardiac events are common and associated with heart dose and baseline cardiac risk. Heart dose is an independent predictor of all-cause mortality, and patients without baseline coronary heart disease are at particularly high risk for major adverse cardiac events and mortality with increasing mean heart dose. They have recruited 748 patients of locally advanced non-small cell lung cancer, and all the hearts were manually contoured. Mean heart dose was associated with increased risk of MACE, that is major adverse cardiac events, with hazard ratio of 1.05 per gray and all-cause mortality with hazard ratio of 1.02 per gray, and that was particularly in CHD negative patients, where they have seen that mean heart dose of more than 10 gray versus less than 10 gray, and they have found that there was increased risk of MACE in CHD negative patients. Their primary objective was to identify the cardiac substructures dose, variables predictive of major adverse cardiac events. The MACE included myocardial infarction, cardiac death, coronary revascularization, and heart failure. For that, 701 patients were identified of locally advanced non-small cell lung cancer. Those were treated with thoracic RT, and a detailed cardiac risk of CHD and Pangemung risk assessment was done. All substructures were manually delineated, which includes whole heart, all chambers, coronary artery spaces. As you can see here, they have delineated all the structures on CT simulation. Coronary spaces were contoured. Dose variables were obtained for each structure, with like mean dose, maximum dose, and V for X-ray, that is X in 5 gray increment to up to 70 gray. Then it was exported in a single step from MIM using custom designed automated workflow extension. Analysis was Cox regression analysis was also done, and cut point analysis was determined. When looking at the patient characteristics, the total number of patients were 701, whereas CHD negative were 449 and CHD positive were 252. As we can see that predominantly it was an elderly population, more than 60 years. In CHD negative, median age was 62 years, whereas in CHD positive, median age was 69 years. And then they looked at the top performing dose variables and the cut points by cardiac substitute. Then left anterior descending coronary artery and left circumflex artery were the top performing dose variables, whereas they performed better in patients without pre-existing coronary heart disease and improved performance in low to moderate dose variables, that is V10 gray and V20 gray. Then moderate performing substructures were total coronary artery and left ventricle. Lowest performing substructures were left main coronary artery and the right ventricle, which performed better in patients without pre-existing coronary heart disease. In multivariable regression model, they have seen that they have reported 70 MACE events where significant increase in the risk of MACE with increasing LAD V15 gray, that is AHR 1.3%, with p-value significant less than 0.001. Significant interaction between the LAD V15 gray and coronary heart disease was seen. Then they estimated, then MACE estimates the stratified by LAD V15 gray more than 10% versus less than 10% in total population, and they have seen that there was an increased risk of MACE associated with LAD V15 gray more than 10% as compared to that of less than 10%. And as you can see that both the curves were widely separated with significant p-value. When they analyzed separately in CHD negative and CHD positive patients, then the results were similar with significant p-value in CHD negative patients, and the curves were widely separated. That is LAD V15 gray more than 10% versus less than 10%. They have again estimated that LAD dose with V15 gray more than 23% and less than 23%, and they have found that there was a significant difference between two groups in CHD negative patients as compared to the difference was more significant and more in CHD negative patients as compared to those in CHD positive patients. Then looking at the all-cause mortality, multivariable regression was seen, and there was total 490 death events were reported. Significant increase in the risk of ACM with increasing LAD with V15 gray, which was significantly associated with a p-value less than 0.001, and significant interaction between the LAD V15 gray and the CHD was found. So at the end, they have concluded that despite the competing risk of lung cancer death, cardiac substructures dose variables are associated with an increased risk of MACE and all-cause mortality, particularly in CHD negative patients. As mean heart dose provides a crude estimate, left coronary dose variables have increased sensitivity in predicting the MACE. That is, LAD dose V15 gray less than 10% in total population, and left circumflex V15 gray less than 14% in total population. These are newly identified left coronary dose volume thresholds are worthy of further study for validation. That's all. Thank you.